Okay, so we're going to be demonstrating forward leaning inversion, and I'm the nurse, Kate. I'm going to pretend Megan's the patient again, and I'm going to pretend like Megan has no bodily awareness whatsoever. When I say that, you have to be sometimes as a nurse very assertive to help someone get into this position, because their inclination, especially like we were just talking about, in some cultures it's considered immodest to be in this position. So you kind of have to use the scripting, be confident, and to help guide them what to do. Just because sometimes people will be like, what do you want me to do? And also the other problem is I always prep them and tell them the benefit of this, because it really can shorten labor quite a bit and make it so much easier for them to push. So when I frame it that way, they're like, okay, yeah, I'll definitely try it.
And it also relaxes the pelvic floor. That allows a baby to come into the pelvis.
Exactly. And it's like, I like hands and knees position too, because
I love hands and knees.
Sometimes people, when they're in a hospital bed, in their brain, they're thinking, I have to behave myself.
Yeah, I have to stay like
I have
this.
to be modest. I have to be, what other words are like metaphor? Just, I have to, like, I'm a patient. This is a
hospital.
hospital.
I have to stay in the bed.
Right, like, so this position, it reminds them this is a bodily experience. Like, giving birth is like very physical. It's like, we try to create that trust and that comfort where it feels okay. All right. Okay, Megan, I'm Kate. I'm going to help you get into forward leaning inversion, and this is going to help get your baby very well positioned inside of your pelvis. The baby has to turn as well as descend, and since your baby has been stuck in this position for a while, the forward leaning inversion is like a reset button for that. So this is like a patient who's been 7 centimeters -2 station for several checks in a row, for example, or that head is up there and won't come down despite strong enough contractions to progress the cervical dilation. Okay, so, and this can be done with an epidural or not. The test I usually do is I ask them if they can lift up their feet, lift up that feet. So if they can do that, I usually have their partner, or if they don't have a partner, I have another nurse on the other side, just in case they like go flying off the bed. Okay.
Put those out just a bit.
You want me to be the other nurse?
Okay.
There. And
Cut.
this one.